Hey everyone, I'm doing my video for the first psychopathology assignment. So I'll go ahead and get started just answering the questions. I'm all bundled up because it is freezing cold. I live in Mississippi. We had snow. So I'm taking my little break at work just to do this assignment with y'all. So number one, ask what is psychopathology? And psychopathology is the study of mental disorders, and then versus normal mental functioning is like no cognitive impairments, able to obtain, like store knowledge, learn, reasoning intact, things like that. And then the other question is, what is the first step in helping someone who comes to you with mental health concerns? I would say the assessment is going to be your first step in getting to know them and just finding out their history and kind of what led them to you. What are the key criteria to determine the presence of a mental disorder? That's going to be like their functioning. Is their mental ability and behavior, is it abnormal? You're going to have to evaluate reports, either by the person or someone who knows them closely. You have to do an evaluation of them to figure out kind of what's going on with them. Observe the behaviors that they're having, or, you know, just kind of trying to get a clear picture of the patient. And then what purpose does making a diagnosis serve? Well, going back to the other question, that to determine the presence, you also would probably do some like little mini mental screening or some kind of assessment tool, evaluation tool to tell you kind of a score or their functioning cognitive level that way. And then to do that leads you to a diagnosis usually. And the importance of getting the diagnosis and getting it right is so that you will know, you know, to be able to classify what disorder exactly it is that they have, what symptoms are they experiencing, and then to be able to develop an appropriate treatment plan for the patient. Are there disadvantages to labeling or giving a diagnosis? I would say definitely disadvantages not to giving a diagnosis, because that's what leads you to the proper method of treatment and the proper medications in some cases, but definitely disadvantages in labeling, because in the video, I think I don't remember the guy's name, I think I wrote it down, David Rosenhan, I think it was, that he did the study where they were admitted and they played like they had schizophrenia. I thought that was interesting because he noted like how limited the contact was with those patients when they thought they had schizophrenia. It was like, I think he said like less than 6 minutes a day or something between all of the staff members. And so that's why it's important for us as staff or social workers to remember that they're people, you know, and they have feelings and needs and lives, and they had lives before and will have lives after, you know, our assessment or evaluation of them and our diagnosis. And it will follow them, but just remembering to you know, be able to sympathize with them and relate to them as people, and to be sensitive, you know, to that. And then it talks about the various ethnicities that there are some disorders that are diagnosed in, and how can we as social workers diagnosing become aware of the culture in the diagnostic process so we can overcome biases. I would say just basically being aware that their history may be a little bit different from your other patients, because they have they've overcome different challenges in their life. Like they may have had to assimilate into a new culture. They may not, you know as much about Americans. They may have had to learn new languages, you know, depending on what culture or ethnicity they are. And then also just being able to assimilate, like with other people. They have a lot of challenges in that, I'm sure, you know, because it's so different here. So just being sensitive to those things, and just kind of knowing their knowing your client, and looking into their background, and also like using like a strengths-based perspective, because you know, the family support, if they have that, then that's always great. You know, that they can have that family unit to help them to get used to their new environment. And then just some of the depression that may be going along with, you know, loss of their region, where they're from. They may have lost their homes. They may have had to move. You know, you don't ever know. And so just basically looking into that background and seeing, you know, what challenges are they facing, and to help them overcome that. And then going back to the mental health labeling thing, just also it's important to remember that not only are they people, but to also remember that there's still a big stigma attached to mental illness in our society. So just kind of being aware of those issues, and then also important to gain their trust, you know, to let them know that you're there to help them. And that's part of the first step too, is just letting them know that you're there to help. So I hope that all made sense. Y'all have a good day.